Well, good morning, everyone. Thank you so much for coming and your attention for this topic. It's really wonderful to be here, and what a wonderful turnout for this day. I'm Veda Giri. I'm a medical oncologist, and I specialize in clinical cancer genetics. And I'm co-leading the early onset cancer program with Dr. Borstelmann. So love Nancy to introduce herself as well.
Hi, everyone. I'm Nancy Borstelmann, and very excited to be part of this initiative, which, as Dr. Herbst pointed out, is kind of critically in the middle of this response to the trend of increasing incidence of early onset cancers.
So we're going to do a joint presentation. I'll kick us off with talking about the ASCO abstracts, and then Dr. Borstelmann is going to talk about our early onset cancer program that we have at Yale. So let me just advance the slides here. Okay. So as was noted, this is really becoming rising in public awareness and has been noted in the scientific and medical community as well, is this rise in early onset cancers. So when we talk about what does it mean to define early onset cancers, for the most part, across different cancer types, this would be cancers in adults ages 18 to 45. There are some cancer types where it could go up to age 49. And what's been noted is this increasing in incidence of early onset cancers, really starting in the late 1990s, but notably in the recent years. We see this increase across cancer types, such as for breast cancer, colorectal cancer, ovarian, pancreas, so really across the spectrum. The two cancers that are really significantly increasing are breast cancer and colorectal cancer. And so we're going to see two oral abstract summaries today that were presented at ASCO that focused on early onset colorectal cancer. And interestingly, there appears to be this birth cohort effect with increase in early onset cancers in Gen Xers and millennials compared to generations before. Again, coming to why is this happening in terms of the multifactorial nature of early onset cancers. And outcomes can also be considered worse in some of these individuals with early onset cancer, and the outcomes can be defined in different ways, whether those are cancer-related outcomes, fertility and pregnancy impact, cardiovascular disease and other comorbidities, and psychosocial outcomes. So in thinking about how to address these issues for our patients with early onset cancer, ASCO 2025 really had a spectrum of studies that were presented as posters or oral abstracts that span the topics that are seen here, such as genomics and therapeutics, psychosocial support, biology, cancer disparities, global incidence, and program development. Yeah, there we go. And so for the sake of this presentation, we decided to take a inclusion criteria as shown here for which abstracts we were going to look over and then think about which ones we had time to present. So this is more of a high-level overview. It'd be great if you went to abstracts of interest and were able to look for further details as well. The inclusion criteria for our review included patient populations ages 18 and above, with keywords such as early onset cancer, young onset cancer, adult, adolescent and young adult, or adolescent young adult cancer. And this particular search revealed 41 abstracts that fit those criteria, and those were the abstracts that were reviewed. And we're going to focus on two abstracts that had more attention at the ASCO meeting, making it to the oral abstract presentation as part of the Quality Care and Health Services Research session. So these two abstracts were focused in young onset colorectal cancer patients, and thinking about this from the aspect of germline testing, so genetic testing for these individuals with young onset colorectal cancer, and then also thinking about social determinants of health and outcomes of patients with early onset colorectal cancer. So what you're going to hear are just a few highlights of the results of these two studies. and a combination of what the discussant said in terms of interpreting these studies and our own take on the studies as well. So when the discussant was putting these studies into context, he really did once again reiterate that early onset cancer and early onset colorectal cancer is significantly increasing for males under the age of 50 as well as females under the age of 50. And this has been a consistent trend that's been noted across various different studies. Once again highlighted this birth cohort effect, which I just mentioned as well, and raised these questions which I think many of us are asking, and we get asked a lot by the public as well, is why is this happening? Who is most at risk? How can we support these patients? What are the unique needs of these patients? And how can we implement or think about early detection efforts for these patients with early onset cancer? So the first abstract presented at this session was titled Empowering Young Onset Colorectal Cancer Patients with an Accessible, Self-Navigable Online Platform for Universal Germline Testing. This was presented by Julie Moskowitz from MD Anderson. And the purpose of this study was based upon the fact that a significant proportion of individuals with early onset colorectal cancer will have a hereditary genetic mutation. So 20% of these individuals will have what's called a germline or hereditary genetic mutation, and that there are NCCN guidelines that support genetic testing for these patients. And so thinking about ways to incorporate genetic testing, make it more accessible to patients, and help that guide risk-based stratification for screening is really the basis for thinking about this study. However, the traditional pathways, which are shown over here on the right side, are much more, it's a multi-step process in terms of thinking of genetic testing, so which can introduce opportunities or challenges for delay of genetic testing with healthcare system barriers, and also where the demand is outstripping the availability of genetic counseling. And so thinking about ways to enhance access in a patient-driven way, since there have been limited strategies that are patient-driven. And the goal is to make it easy for patients, make it accessible, make the importance of genetic testing known, and also to provide this approach for patients in a way that can be around the patient's time. So the study was a prospective study, a quality improvement project that was at the Tertiary Referral Cancer Center and included patients who were newly diagnosed with colorectal cancer, ages 18 to 50, and there were some exclusion criteria that were noted there. And what they did was that they invited these patients to participate in the study into this online platform. So this study was really employing digital strategies to help improve genetic testing access and uptake in a patient-driven way. Patients that were interested in the study would then watch an educational video about genetic testing, and as such, this would be the way to have pre-test education. And those patients that were interested to proceed in this online platform, this electronic approach, after signing informed consent, would then proceed with the informed consent online and appointment for genetic results. Counselor and go through the pathway in that way and proceed with genetic testing or decline genetic testing. And so the results that were highlighted at ASCO was that 377 patients with young onset colorectal cancer were identified, and over 200 were invited to the online platform. 160 patients expressed interest to move forward, and of whom 82 elected to go forward with this online platform approach, of whom 79 actually completed genetic testing. So they highlighted the fact that the genetic testing uptake was about 96% with this online approach in that subgroup. An additional 14 patients had pre-test genetic counseling, of whom 10 completed genetic testing. Now, the discussant did note that that still means that about 50, in total, 55% of the patients that expressed an interest in genetic testing actually went on to complete genetic testing. So some of the takeaways here is that For some patients, online digital approaches can actually be very useful and helpful and enable them to proceed with genetic testing. But there are still some challenges. So in the study, there was some loss of follow-up, still have to address insurance barriers and things like digital and technological literacy. Can technology be embraced by all individuals, or is that still a challenge? So one takeaway from that study is that at our Cancer Genetics and Prevention program at Yale, we have been using more digital tools as opportunities to enhance access to providers who want to initiate their own genetic testing, and also for patient-driven strategies as well. And we actually have a study that's going on now looking at pre-test education video for Black males regarding genetic testing for prostate cancer and having that be a patient choice as well. The second study to highlight from the oral session is about real-world social determinants of health and outcomes of early onset colorectal cancer, presented by Dr. Paulus from the US Oncology Network. And really important to highlight is that social determinants of health can impact every known or suspected risk factor in terms of the impact of risk factors that are known across the lifespan of an individual. And these social determinants of health really do span major domains as shown here: education and access, healthcare quality, ability to have social support networks, and neighborhood context, and educational and economic stability. And so the objectives of this study was to leverage one of the largest community-based oncology networks to think about the impact of these SDOH factors in early onset colorectal cancer versus average onset. And the study design was a retrospective observational cohort study from January 2000 to December 2024, and included this population of patients 18 and above with a diagnosis of colorectal cancer. And what they reported on, the results included over 104,000 patients with colorectal cancer, of whom approximately 14% had early onset colorectal cancer. Important to note that there was a strong representation of racial and ethnic diversity in this population, and that there was more diversity in the early onset patient population versus the average onset population. And also a higher prevalence of obesity at diagnosis in the early onset colorectal cancer patient population versus the average onset population. They did note that early onset colorectal cancer patients were more likely to have stage 3 and 4 disease at initial diagnosis. And they also did some distress thermometer assessments using the NCCN distress thermometer, and reported that early onset patients with early onset colorectal cancer tended to report higher distress scores. And when thinking about predictors of overall survival, advanced stage at diagnosis still remained the strongest predictor of overall survival for these patients with colorectal cancer. And so some of the takeaways from this particular study was that, once again, it was noted that there was this higher prevalence of stage 3 and 4 disease for early onset colorectal cancer. And important to note that this was from this diverse, racially, ethnically diverse cohort of individuals. And important to always continue to study this in terms of thinking of the impact of colorectal cancer and cancers in general across populations. Advanced stage at diagnosis was the strongest predictor of overall survival. But one of the things to keep in mind is that, as we mentioned earlier, SDOH, social determinants of health, is really a combination of many additional factors, which really were not reported from this particular study. So important to keep an eye out for those. So in terms of priority strategies, we really still need to address things like diagnostic delays. How can we identify cancers at an earlier stage in a population with early onset colorectal cancer? Many approaches right now still rely on risk-based algorithms for these patients who are under the age of 45. So thinking about family history, opportunities for genetic testing, as these can inform earlier age of screening. Again, also important to raise awareness across diverse populations and really thinking about the psychosocial support given the report of the higher distress scores. And then just to bring to your attention a few other selected poster abstract presentations, just to give an idea of the current conversation about early onset cancers. There were multiple abstracts presented about national and global trends, genomics, and just want to give a shout out to our genetics team that also presented an abstract as a poster about genetics and family history in a diverse cohort of females with early onset breast cancer. Therapeutic posters regarding therapeutics and biology, sociodemographics, program development and psychosocial needs, and sexual health. So just before I turn it over to Dr. Borstelmann, how do we sort of summarize some of this information and think about what we can do? So really many of the questions still remain and are very strong. Why is this happening? What can we do about it now? And how can we go about making a positive impact against early onset cancer for patients and their families? And research is really critically needed to advance understanding of these issues, critically needed across disciplines and populations. One conference to keep an eye on that's coming up in December is through AACR, which is specifically focused on the rise in early onset cancers, knowledge gaps, and research opportunities. We will be there as well. We'll be planning to present some research there as well. So it shows really the attention that's being paid to this from the medical scientific community and certainly to help the public. And what can we do now? How can we go about making a positive impact? Some of the ways that we can think about this is psychosocial support, education and awareness to the public, to our communities, to our collaborating providers and researchers, developing dedicated programs, and thinking about inclusive efforts across populations. So we'd like to now talk about our early onset cancer program here at Yale Cancer Center and Smilow Cancer Hospital as one of the strong approaches that we have in terms of addressing this need for early onset cancer. And I'll turn it over to Dr. Borstelmann. Thank you.
All right. Thank you, everyone. Can you hear me okay? Okay. All right. So with the context that Dr. Giri just presented from ASCO, you can see the range of needs and the opportunities for growth in early onset cancer, the early onset cancer population, and the opportunities that we have taken here at Yale include developing a dedicated program for patients who are diagnosed between the ages of 18 and 45. And our mission is really to reduce the burden of early onset cancer for these patients and their families and improve their quality of life through a variety of initiatives. So what we've started out with is developing a program that has four sort of main pillars: a clinical, a research, psychosocial, and community awareness, so that we're addressing needs across all these domains. And we also have a very critical and strong commitment to addressing disparities in each of these domains. We also have developed a website that is, we think, strong, also comprehensive, and the URL is here and the QR code for anyone who would like to follow up, or just Google Yale Cancer Early Onset Program and it'll pop up. But the importance of the website is one of the critical aspects of any program development is awareness. So we want to be sure that internally and externally there's awareness of a program here dedicated to this population. Okay, so, all right, I got my 5-minute warning. So, so this is our core, we have a core team, myself and Dr. Giri, program managers, some key staff, strategic planning partners, and other attendings in essentially in critical areas like colorectal cancer. We also are backed by a range of stakeholders throughout Yale who are our steering committee. So we're trying to stay in alignment with other programs and the real needs across our different cancer diagnoses. As was mentioned earlier, psychosocial issues for patients with early onset cancer and their families is a critical pillar of our program and important issues to address in order to help these patients engage in their cancer care and ensure that they continue to sustain the best care possible. So common challenges, of course, for all cancer patients, it's devastating. There's so many impacts on their life, but these can be heightened because of the age at which these patients are diagnosed. So it essentially can throw them off their path. And things like parenting, their social life, how to fit in, how to have communication with family and peers, family planning issues, critical decisions that may need to be made about fertility or family planning, fertility preservation at a time when you may not have expected to have to confront those sorts of issues. Financial toxicity, I think everyone in this audience is aware of the challenges there related to cancer care, and can be even more complex when you're younger. You may not have savings to really support that, or the right insurance plan. Coping and emotional needs, absolutely essential to address anxiety, the isolation that patients can experience, body image, sexuality, caregiving. You may be in the sandwich between parenting and having aging parents or other relatives. And then facing interruptions in one's career or work plans. So there can be a lot to have to manage. And so with that, in our program, one of our early initiatives has been focused on, and we call it Connect, focusing on helping with early outreach to early onset patients. We have a early onset coordinator who will reach out and go through with the patient essentially a guided interview that covers a lot of these domains related specifically to a younger patient. And then we'll share with them tailored information, really a personalized approach, so that they're getting the resources that they need about their priority concerns at the time they are happening. And then and then that coordinator will place referrals, connect with other services, essentially be a bridge to other supports for the patient. For some patients, they have more complex needs, more acute needs that might need longitudinal attention. And the coordinator makes a referral to our early onset specialist, who will then work very directly with that patient, and always in coordination with the clinical team, social work, nursing, and others on a case-by-case basis. So we also have some initiatives that are developing in research, community awareness, and clinical care, and all of it is really part of a piece to enhance the care for patients in this very important and growing, sadly, population. So thank you. Questions, comments?
Excellent. We have time for some questions or comments. I don't know if anyone has one. I have a couple of microphones here.
Hi. Just a quick question on the age range for that program. Is there any wiggle room at all if you have a 46-year-old patient? Are they not ineligible for it?
No, so as we were trying to think strategically how to roll this out in a systematic way, we addressed 18 to 45. But if there's a patient who's 46, 47, 48, who is struggling with any of these issues, we absolutely will be happy to see them. So,
Any other questions? I'll ask one. Veda, why are there so many more early onset cancers, and do these tend to be more aggressive cancers?
Mm-hmm. Yeah, it's such an important question, and some of the studies are looking at things like, so I mentioned this birth cohort effect, right? And I thought that was really fascinating, because thinking about Gen Xers and millennials versus generations before, baby boomers, et cetera. And that points to, could it be exposures, environmental, other lifestyle factors that could have been part of these more recent generations? So there's a lot of research going on to look at environmental diet influences for this rise in early onset cancer. And it really depends on the type of cancer as well, as we think about this. One of the underpinnings for all of this, and this wouldn't necessarily explain a rise, but a risk, is genetics, is maybe really enforcing the fact who's predisposed to these early onset cancers, and are they considering screening at an appropriate and younger age. Some of these cancers can be more aggressive, to your question, but some of them may not necessarily be so. And the key is, as much as we can to catch them at a point where there can be, caught at a curable point, so to speak, for some of these cancers. And so lots more work to be done, in that space.
Great, thanks. Any other questions? That was really wonderful. Great way to start the day. We now know about those who didn't know about the program now. So thank you both very much.
Great, thank you.
Thank you.